Hello dear friends, I'm glad to see you on our channel. We continue to work and share very important and useful information for you. If you have any questions, please write right now. Also like and subscribe, we'll be glad to make new friends. Today I would like to make out one moment that is associated with the ratio of the jaws. We very often call it the central relationship or some other name. We will take it all apart. And for us as clinicians, for specialists in the field of dentistry, why is this ratio important? The fact is that we compose models in the articulator and then the technician does the work. An error in determining such a ratio often leads to rather serious problems. Therefore, I would like to discuss this moment today. So, what is the central ratio of the jaws? If we take the anatomical view of this, all dental dictionaries speak of the anteroposterior position. That is, if it is a glenoid fossa, a tubercle, then the condyle is located at the base of the tubercle in the anterior upper position. This is such a somewhat controversial issue, of course, and often doctors try to measure the ratio of the jaws in the joint using X-ray, but actually this is not correct. The second very important aspect of the ratio is reproducibility. The point is that we must give a technician one exact ratio that will be constantly reproduced. Otherwise, if he made your crowns with ceramics, you start to feed them and get a different ratio of jaws. You have to grind crowns, right? Or chewing movements cause discomfort to the patient and so on. That is, in general, there are a number of problems that may arise. Actually, we definitely will discuss the dentition itself. I highlighted the main factors. This is a static position, a multiple times repeated position, then that is done for medical purposes, that is, we don't look for it just for nothing, and one of the most important aspects is that the muscles must be relaxed. That is, there should be a balance of the joint position, the condyle and the glenoid fossa, since the lower jaw is anatomically connected with the muscles and ligaments to the upper one. These are the main criteria that are important to us. A stable reproduction with relaxed muscles. To this can be added the pure rotational movements in the joint, which within 15 to 20 millimeters of opening, sometimes less. Then the translational movements appear, so there is a whole set of anatomical criteria that we use. We also know that there is a distance between the central relationship and the central occlusion, the maximal contact of the teeth. This distance is called long-centric, the transition from the central ratio to the central occlusion. And even now, when you look at me from the screens of your gadgets or computers, we can conduct such a short experiment. Look, relax as much as possible your muscles and gently help yourself to close your mouth. You will feel the initial contact. That is, your teeth will not close immediately, but some primary contacts. The primary contacts appear that prevent complete closure. And then you start to close your teeth completely and get a complete closure of the teeth. Multiple contacts if, of course, you have teeth. Otherwise, again, this is a very important aspect because often dentists are oriented to the teeth when determining the central ratio. And the central relationship is characterized by the relationship of the articular structures. We must forget about it. Therefore, if you want to understand what the central relationship is, you should imagine that your patient or you work with such a patient that has no teeth. So there is nothing to be oriented to. So how can compare to toothless jaw? We relax the muscles, find this ratio of the jaws, and only then we can work. The same goes for planning orthodontics, for diagnostics, for total prosthetics. For example, a toothless jaw. But if there are 18 implants or 32, maybe you remember there was such a picture on the network with 32 implants, the most greedy dentist. What's the difference? No teeth, nothing to be oriented to? Therefore, there is a certain concept that makes it possible to compare even toothless jaws. So there are certain anatomical features in the structure of the joints, and they will also affect the central relationship. But now I would not delve into anatomy. I would like to say a few words about the ratio of the jaws. I have made such a chart for you. I have already spoken about it in one of my videos, but as it is said, practice makes perfect. The central ratio is a certain specific target that we are trying to hit. We start looking for it. This is our target, and look, I made such shots. This means when we determine, we start shooting. And now we have found a certain ratio in the joint. The fact is that the ratio you found at first is not often right, because patients already come to us with joint dysfunction and problems. They have pains and discomfort, some other problems, and you think that we can achieve relation for them in stride. This is actually highly presumptuous. But if the patient has good adaptation, he has a normal chewing system, everything is fine with him, then even if you have a mistake, the adaptive ability enters into force after some time. The patient will get through it and will function normally. But the situation changes somewhat in another aspect. Note, if the patient has a history of temporomandibular joint dysfunction, there is a large French study where they studied women. Generally, it is very interesting to study women, but they were investigated within the framework of the central relationship, to be exact, the occlusion. And they found that different patients groups responded normally to interferon contacts. What they were doing, they were adding interferon contact into the occlusion of these ladies. But there was a group that presently, stably, and statically, and probably badly reacted to adding interferons into their occlusal scheme. And this group is a group of patients with a history of TMD. Therefore, you and I should treat this kind of patient with greater priority. Why did they react to it like that? Not because they were interferent more, no. The fact is that the adaptation zone, look, I marked it with such a square. It is narrowed. Of course, in a two-dimensional scheme, this cannot be determined. It is a multifactorial problem. It does not add up to 2 or 3 questions with which you solve problems, and such patients that would simply be treated with a bank. There are more problems, but we talk about a decrease in adaptive capabilities, so that it can be understood and imagined, and our impacts can cause a breakdown in adaptation. Therefore, for these patients, it is extremely important to determine the central ratio more accurately. And here we go through the stages of this definition, that is, we define the central relation. This is often called RP, reference position number 1. After then, you prepare, you do a splint, relax muscles, you treat the teeth, provide extraction of the ASTs. The person calms down, everything is right, and you predetermine the ratio of the jaws. And what do you get? A different ratio, but you and I said that this is a stable position, reproducible. How so? Has it suddenly changed? The central relation is still the same, but the patient has become more relaxed and more adapted, and then we can more accurately find the desired position. Also, here one can say about other ratio of the jaws. When there are deformities, it is a range position and adapted position and so on. There are quite a few of them, but a separate video can be dedicated to this issue and it can be discussed in more detail. In the next video, we will analyze indications for the central relation, and theoretically we'll talk about what registration methods that there are. Further, we'll make several videos on each registration method. The first is an enforced method of determining the central ratio, which I use the most. I will show you how to make registration, what are the nuances and so on. I will show how to mount on the articulator. We have a lot of work to do and we will try to tell you all about it. We will also use other methods, for example, jig, front programmers, a coast programmer. I will find the equipment and we will electrocute the person, compare everything and show you everything. It will be very interesting, especially for those who are deeply and professionally engaged in dentistry. Therefore, we are waiting for you again on our channel. Like videos, write your questions, and the next video will be about the theoretical justification of the methods for determining the central ratio. See you. Bye.
Пока.